This is a video on a standard NICU PICC line dressing change. Prepare your baby for the procedure using any PRN medications that you may have or sucrose. You must have at least 2 providers to complete this procedure safely, 1 to do and 1 to hold the line. In order to provide best and safest care, you may need to gather other providers designated to assuring the safety of the ET tube and ventilator. You may anticipate that the baby might need 10% oxygen boost throughout the procedure and also to have someone silence the alarms. Be sure you have other providers available to hold extremities that may compromise the sterile field. Discussing the process ahead of time really makes a big difference in how fast this procedure will go. Your positioning around the bed, which side is best for doing the procedure and which side is best for holding. Are you right-handed or left-handed? Clean all your work surfaces with a cavi wipe, including all the surfaces that you're going to put your extra gloves on. Then wash your hands. Then gather your supplies. I also brought extra adhesive removers, suture removal kit, including the 2 Tegaderm HPs. However, please don't use Tegaderm HP on the doll. Extra sterile gloves for my holder and for myself. Any other supplies needed, sterile Q-tips or hub guard, etc. On the top of your kit, you have masks, adhesive removers, and Purell. Lori and I are both right-handed, and we discussed ahead of time that it would work best if I was on this side of the bed and Lori is on the other side of the bed. Lori is wearing sterile gloves. Her left hand will hold the baby's foot, and her right hand will be dedicated only to holding the line. There would be another provider up at the top of the bed holding the top part of his leg and the line, and another person holding the right leg. The person holding the right leg is able to give 10% button pushes and silence the alarms. You may choose to put your sterile drape down now or follow the steps shown in this video. Here I like to set up my second pair of gloves at the back end of the room, making sure that I had cleaned that work surface prior to setting down my gloves. You notice how I'm picking this up with my hand and not over here. I'm trying to keep as sterile as I can, like that. I recommend that you get your supplies set up prior to taking the dressing down. Again, please don't use HP on the doll. As I discussed in the part 1 of dressing changes, in the tips section, I determined my size of my Tegaderm ahead of time. So I'm going to cut it down to my preference. Okay, so I think I'm ready to start taking the dressing down. Now it's important to remember whether you're sterile or clean. Right now I have sterile gloves on and I am sterile, but as soon as I touch the baby's leg and the outside of that dressing, I am not sterile anymore. The key here is I am doing this dressing change and I am as clean as I possibly can be, even taking the dressing down. Here you see me using the adhesive remover to loosen up the top 2 steri strips on the dressing. This adhesive remover dries rather quickly, so using the wringing out technique works rather well. Here you see me removing the top piece of Steri-strip that goes across the top of the chevron Steri-strip. Remember to put your Steri-strips down on something sterile away from your sterile field. You see me removing the chevron piece of the Steri-strip. Lori's making sure she has a firm grip around the heel of the foot. Lori's right hand is her sterile hand. It is dedicated only to holding the line underneath the dressing. It's never a good idea to multitask with that sterile hand. Removing your tegaderm can be difficult to get started, so lifting a little bit of the line that comes out of the dressing can give you a little pocket, and then you're able to start pulling down your tegaderm. If you use adhesive remover to remove your tegaderm, be sure that some of your tegaderm is released so that your adhesive remover liquid can track underneath the tegaderm. I'm going to explain the pull technique next. Pulling tegaderm in this way really doesn't hurt. When using the pulling technique, it's important to secure the line that's underneath the dressing. I'm using my left thumb here, and I'm holding the line as I'm pulling out with the tegaderm so that I don't dislodge the line when I'm doing that. Pulling the tegaderm straight out rather than straight up works really well to release the tegaderm away from the skin. I like to release the edges of the dressing as much as I can, but not as to release it off of the line. I want to make sure that's still secure until we're ready. And going to the other side of the dressing, I'm going to release that, and I'm going to use the pull technique again, but I'm going to hold the butterfly so I don't move the butterfly as I'm pulling. And I want to get all the way around so it'll come off pretty easily. So I'm going to hold again, pull, pull. Okay, so we're almost off the butterfly now. We're going to talk to each other as we work our way down. Now it seems like it's pretty sticky right now. So what I'm going to do is I'm going to grab another adhesive remover. If you plan to touch the line underneath the dressing with the adhesive remover, remember that your hands are not sterile anymore. So the side of the adhesive remover that you have touched is not sterile. So be sure to use a corner of the adhesive remover that is sterile still, like this. Okay, so now I'm going to go up a little bit more, and Laura, walk your fingers up the line. And let me know if you can't see anything, Laura, because I need you to see. Good job. All right, I think I'm off. There you have it.
Site is free.
Okay, take my gloves off. Clean with Purell. Use as much friction as the baby will tolerate. And when you get closer to the line, use a blotting technique. Be sure to communicate with your holder as you're cleaning around the site. At this point, I would have the holder that's holding the top of the line flip the butterfly around so that I can clean behind the butterfly. Okay, so now as far as getting at the site, probably the most important part, right? So Lori can actually roll her fingers or trade fingers. So I wouldn't totally let go of the site, Lori, but if you can take your finger and roll it down a little. And she's still on the site, and I'm just gonna dab here. I'm not gonna go crazy with friction. And then go back up a little so I can get underneath that part. And then we will make sure that all of it's dry. All right, so I'm gonna see if you guys can turn the baby's leg out a little, and I'm gonna try to get in here and lay it down on the baby's skin, and I'm aiming the bottom at the ankle a little bit. So I have it secured now, and now I can give it a little tug, and I'm gonna go closer to Lori's pointer finger and say, go ahead and move. And I'm gonna still have a little pull as I'm slowly laying the tegaderm down. At this point, you can choose to move the butterfly over to get it away from that insertion site. As I lay the tegaderm down, I'm smoothing around the line, making sure there isn't any air pockets. So I think that went pretty well. We'll assess the situation in a minute. Taking off the edges of your tegaderm can be just as important as putting down your tegaderm in the first place. Make sure that you go slow and pet your edges, making sure that you have a secure tegaderm on the edges. That's the first place where it will come up. So now I just want to assess real quick before I put my chevron on. You should also assess how far the tegaderm is away from the line itself and make sure that there's enough room. Remember, you can stack tegaderm over the top of other tegaderm. It's not considered a reinforcement until you remove all your sterile field. The first piece of Steri-Strip is the chevron. It gets placed sticky side up, and it's best if you can track along the top of the tegaderm. It helps the tegaderm stay down. Then the next piece of Steri-Strip goes right over the top of your chevron, and you can cut the edges if you need to. Be sure to cover this little loose area with another piece of tegaderm or a Steri-Strip. And don't forget to place your date change sticker.